it's very can be quite scary at times, but God has honestly blessed us in this time. I think that's one thing that has dawned on me, that we are in such an amazing time where actually a vaccine can be produced in such a rapid time. You know, rather than thinking of it like, wow, why is this thing? How has it happened so quickly? And is it really safe? It's actually an amazing thing that a vaccine can be produced so quickly, because ultimately it can prevent a lot more deaths than previous viral infections, pandemics, where a lot more lives would have been lost or have been lost because of how the speed at which treatments and vaccines are produced. I think that's one thing that I think people should maybe kind of think of instead. It's concerning. There are a lot of concerns which I think are very understandable, but equally, I think that, like Pastor Shola said in the beginning, we've been praying for wisdom concerning treatment and for things to get back to the way we believe, the way we know. And so I think it's important to look at all the facts and to really hear and understand how this vaccine can help us and help everyone, based on our own personal decisions. But hearing the facts is very important to be able to make that decision. So that's my perspective and that's my experience in total. So I will hand over to Dr. Bimfolo.
Thank you very much, Ibi. Just before you go, one of the things you mentioned is you've seen firsthand the impact of the vaccine, of the COVID on the lives of people in the world. But in terms of now, I don't know if that happens. So if someone has been ill in the world and they get the vaccine, has there been a rapid turnaround, or what's been the impact if somebody is ill, and has the vaccine made a difference after they've been given the vaccine? Or
so typically it hasn't happened in that way, whereby someone has already got the infection. The way in which we would approach it is that we would try to treat the symptoms rather than giving them the vaccine. The vaccine is more preventative. It's a preventative method rather than a treatment. So there hasn't been that sort of scenario. However, I think one thing that I'm so grateful to God about is that from December, where things got really crazy, the hospital was like booming in terms of there was just no capacity to accommodate the amount of COVID admissions. The staff it was just crazy because there wasn't enough staff to cover the wards in terms of doctors and nurses. And when I compare that scenario to now, it's a huge difference. And to be honest with you, primarily it has been because of this vaccination program. So it not only has it affected the lives of people and preventing them from getting more seriously ill, it has helped relieve the pressure that really could have damaged the NHS for good. So the vaccination program, the vaccine has had a tremendous positive results just in this short period of time. So yeah.
Thank you very much. So what I hear is that it's made a lot of difference in terms of the pressure, in terms of the people falling ill. It's made a lot of difference. Thank you very much for that. We'll call upon you again once we have some questions during the Q&A session. Thank you. Okay, we're moving on, and I'll be introducing Dr. Bimfolo Abitoye. Now, most people in King's Court Chapel know Dr. Bimfolo, but just in case for those that don't, but Dr. Bimfolo is an experienced GP in Milton Keynes. She works in the practice. I think she's actually the practice manager, if I remember correctly, if I'm right. And she's also one of the vaccinators in Milton Keynes. So she will be one of the people, or she is one of the people that will be giving out the vaccine within the town. So help me welcome and appreciate Binfolo as she comes and shares with us her thoughts.
Good evening, everyone. Good evening, Pastor. Good evening, sir. I'd like to thank our pastors for this opportunity to be able to enlighten us more about the COVID vaccine. And I'm grateful. Thank you, Dr. Ibi. I'll just take it off from where Dr. Ibi stopped. And yes, with the vaccine being made, we have seen a rapid decline in the cases of people that have had to be admitted into the hospital, and also overall deaths as a result of the COVID pandemic. And that is the aim of the vaccine. So my role here, until we have questions coming up, is to talk a little bit about this vaccine. I'll start with the aim of the vaccine so that I can take off also from where Dr. Ibi left. The vaccine for now is not to treat the COVID infection. So it means it's not to treat the infection, and it is not to prevent you from getting the infection. And that's why even with the vaccine being made and administered, we're still encouraged, to take all protective measures, put on our mask, continue to wash our hands. But the aim of the vaccine is to ensure that, so I'll try and use layman's language as much as possible. So it's to lessen the effect on you should you be exposed to coronavirus, to prevent the severity, so that we don't become seriously ill from it, needing hospital admission, and of course the other spectrum, with it leading to death. So that's the aim of the vaccine. And the way it is that those that have made the vaccine, we all know that at the moment we've got two. So we've got the Pfizer vaccine, and we've got the one made in Oxford, the AstraZeneca. And if I just put it simply, it's the mRNA. So a tiny molecule has been made to mimic what the coronavirus looks like. And it's put, in the reagent that is used for the vaccine, and it is injected into us. And the aim is that when it goes into the human body, it is mimicking coronavirus. So the way your body sees it is, oh, this is an enemy. This is coronavirus. It is not the virus. And that has been made very clear. It is not coronavirus, and it is not a live vaccine. It mimics it, and your body starts to see it as an enemy. Your body starts to build immunity to it. It starts to create memory cells. It builds up your immune level so that if you then come in contact with the coronavirus, you've got all the antibodies, what I can call soldiers in your body, to fight that infection, so that the effect on you is not as serious as it would have been. So simply put, that is what the aim of the vaccine for now. As years go by, in medicine, in science, things will continue to improve, and it will get better and better. But at the moment, it is so that if you should get it, then you just get mild symptoms, almost like the common flu that has been around. So that's the first I would say fact about the vaccine that I want us to know about. So like I said, it's not a live vaccine, and your body builds immunity to it, and the aim is to prevent serious illness should you come into contact with the coronavirus infection. And also with regards to, so covering a few of the facts also. And my thoughts is that it probably will come up in questions also. The way vaccines are made, because there's been quite, a lot of news coverage about the safety. The corona vaccine is safe. So before a vaccine is made, they need to make sure that it is safe, it is effective, and it is needed. We will all agree that it is needed, with the scale of the pandemic that we've seen and the effect. Now it is safe in that the way the science world goes is that when the vaccine was being made, so both for the Pfizer vaccine and the AstraZeneca, they have people who have volunteered. Some of us might even have received the invitation, to be volunteers. So people have volunteered and they have trialed this vaccine on them. And we're talking tens of thousands of people. And what they've done is they've taken people across different demographics. So male, female, different ethnicity, different age groups. The children have been left out from the trial, but from ages 16 and upwards. And these are people that have not been exposed to they've not had the coronavirus infection. And they have given them the vaccine, and then they monitor, the antibody level to see how much of the soldier, so to speak, they have in them. And what they've done is, let's say, for example, 10 people have volunteered. They've given the vaccine to 5 randomly. You don't know what they've given to you. And to another 5, they've given placebo. So something like maybe just water. They monitor the level of the antibodies. So they were able to prove that in those that were given the vaccine, they had significant level of antibody to fight the infection compared to those that have not been given. And also what they've also checked is that, and for patients, who are not in the trial but have had the coronavirus infection, they've also monitored the antibody level, to be able to compare results. And they have seen that it is quite effective, the vaccine. So like the Pfizer is about 90% effective from trials, and the AstraZeneca is about 70%, effective overall. And also with research is they've done phase 1, phase 2, phase 3. So it's been thoroughly tested, and it's been shown to be safe, effective. And also just to mention that there are ethics, in modern days. Maybe in the old, there has been times when, you could fault some trials or the way some vaccines were made, but there are ethics guiding vaccines being made. And so the bodies, the pharmaceutical companies have had to go through all this, and they've been tested and tried. We have the Medicines and Hospital Product Regulatory Agency. And what they do is they check every stage to make sure that what is being done is safe. So no cutting of corners. It is a safe vaccine. And like I said, I've mentioned what the effect is. Briefly, I'll just talk about side effects, because I know that that has been the worry of some people also. The side effects, every medication, has a side effect. And with the vaccine, the side effects are not really different from side effects that you get from other vaccinations, your tetanus vaccine, your hepatitis vaccine, your flu vaccine. The side effect, the common ones, the immediate ones are you feel a bit sore, where you've had the injection. It might be a bit itchy. It might be, a bit achy around the joint there. And then in some people, for a few days, they might have fever, body ache, they feel tired, headache, but all this improves, as the days go by. And also when you take things like paracetamol, ibuprofen, within a few days, the side effect, is gone. And at the moment, what the government is doing is they are inviting people for this vaccine in order of how vulnerable they are. So there are different phases, but the aim is that by about summer, all adults, would have had the vaccine, and adults being ages 16 and above would have been vaccinated, which is a very good process. having the vaccine does not mean that you cannot have coronavirus infection, like I've explained, but then you just then have minimal symptoms, just like flu-like symptoms. So we've had the elderly up to, I think at the moment we're on about 70 and above. And then healthcare, if you work in the health and social care, because you're exposed to patients who probably, might have it, those people have been invited. And then also, if you're thought to be at risk of having serious complication, should you have the infection, then you will be invited. But the invitation comes from the government. And the aim of this talk is that we'll be able to address your concerns, and that when you get the invitation, you will make, like Pastor said earlier on, it's an informed decision. So you're not being forced to take it, but then you have all your facts and you can decide, that, okay, I want to take, I'll go for this vaccination. Pastor, should I stop here, sir? Just cover questions that people have.
Okay. Okay, yes, so that we can try to keep it to 1 hour, possibly. People have sent in some questions, which I'll ask a couple of them and put it to yourself and Ibi. Can you help me? Can someone help me spotlight Ibi as well, so that we can have both of them on the screen? So Ibi and Dr. Binfolu. Now you can still send your questions if you have any question that has not been covered. I think you've answered a number of them, but one of the questions that has been asked is, which of the vaccines is safe for pregnant women? Okay, Binfolu, if you want to answer, since you've been, which of the vaccines is safe for pregnant women?
So I will just cover both vaccines. So like I said earlier, when the trial was being done, it was done for people ages 16 and above. Now, it wasn't trialed in pregnant women. And that's because it's still work in progress. And it'll be a bit difficult to get a pregnant woman that will say, give me the vaccine, let me see what side effects, whether immediate or long term, we will I will get from it. So at the moment, we don't have enough data with regards to pregnant women, and how safe it is. So the advice at the moment is that if we get a pregnant woman that wants the vaccine, whether the Pfizer or the AstraZeneca, we weigh the risk and the benefits. So there's some pregnant women, for example, you're pregnant and you work on a COVID ward. The risk of the harm from having a coronavirus infection is, quite high. So in such a person, the advice would be to have the vaccine, but there is maybe what I'll call a disclaimer in that we need to then advise them saying that we do not have sufficient data, we don't have sufficient data to be able to advise you on the long-term effects. It's still being monitored. So I would say for now, if you're pregnant, except you are at risk, from developing quite severe infection from the coronavirus. So for example, some pregnant women have underlying medical problems. Some pregnant women might be morbidly obese. So in that sense, it's more serious if they have the corona infection. So we will give it to them. But with regards to the safety, we don't have enough data yet for pregnant women.
Okay, let me just extend that question a bit. So you've answered the one about pregnant women. How about
Yes.
women planning to get pregnant and those breastfeeding? Is that the same advice or is it different? Is it safe for them?
So with regards to women trying to get pregnant, there also is no sufficient data. But what has been said is that, for example, if you have the vaccine and then if you have the vaccine now, there's nothing preventing you from being pregnant. you can go ahead, or if you have the vaccine, then suddenly you realize that, whoa, I'm pregnant. There will be monitoring for such women, but we don't have enough data as to say if it will harm the pregnancy or not. So the decision might be to err, on the side of caution. With regards to breastfeeding, there is no evidence to show that it will affect the baby. But again, it's more of a disclaimer saying it's with regards to benefits and risk, the underlying medical condition, the nature of the job, of that woman would inform if it's better she takes the vaccine or not. But so far, there has not been enough people in that field to assess for side effects.
Okay, thank you. Okay, next question. Somebody sent a question here, and I'll leave it open to either yourself or EB to answer. And it goes, now I'm not sure where they got this, but I may not be aware of it. It goes something like, why do some people react or even die after the vaccine has been administered? Who wants to answer that?
I've not heard of, anyone dying from the vaccine. And I think what's happened also with reaction, like I said, there are short-term side effects, which is the more common one. There is that side effect of, there is a possibility of having an anaphylactic reaction. And that is a very serious reaction, which affects the breathing and could be quite fatal. Since the development of the vaccine, that has been looked into. And people who have such reactions are people who have allergy to the components of the vaccine. So there is safety in every process of administering that vaccine. So what is done is before you're given the vaccine, the vaccinator will ask, how are you feeling that day? Because what happens at times is some people might be feeling unwell, and they will mistake what symptoms they're having from already, feeling unwell with any other symptom from the vaccine. So if you're feeling unwell, the vaccine is delayed a bit until you're feeling better. They would also ask if you've had any allergic reactions before in the past, and ask what it is exactly. And so if it is an allergic reaction to any of the components of the vaccine, then the vaccine is not given, and more advice will be sought from the company and the specialists. Another way in which there is a bit of safety netting is that, especially with the Pfizer vaccine and even also AstraZeneca, so there is a period of observing after the vaccine has been given. So you stay in the waiting room because most reactions are immediate. So whoever is going to get an anaphylactic reaction, which is the fatal one that will lead to death, you will be in the immediate there. So you're there in the open room. There is a healthcare professional observing you. And the guideline is that such a person, everybody stays for 15 minutes before you can leave. If the person has a history of reaction to anything in the past before and has been given that vaccine, then they're monitored for longer, for about 30 minutes before they go home, and then they're given all the advice as to what to do if there's any untoward effect. But the serious side effects have been really very rare.
Okay, thank you. Ibi, maybe you'll be able to answer this, so let's get your perspective. One of the things, the director of policy within the Milton Keynes Council has been in touch with us, and also things that have been in the papers and in the news. And one of the things that has been observed is that there's been a low uptake of the vaccine amongst the BME community. And one of the things, specifically within Milton Keynes, that have been informed is that health and social workers and some medical personnel as well within the Black community are reluctant to taking up the vaccine or taking it. Would you have an insight into that at all, and the reason, Ibi, and what would you say? I don't know, since you work in the world, what's been the experience? Do you find that people within the BME are not taking it up?
I think there's definitely some truth to that, based on the data and my own personal sort of interactions with staff members. Ultimately, I think that these fears are based upon very real, historical events that have unfortunately disproportionately affected people from ethnic backgrounds. There has been a mistrust of the medical field, that unfortunately, yes, there has been some mistreatment and some sort of, taken advantage of in terms of people from ethnic minorities. So these feelings, I think, are definitely very real. However, one thing that is important is that a lot of time has passed, and a lot of awareness has taken place. There's been a lot of advancements that I think people should understand and be confident in. There are systems in place to make sure that the vaccine is safe enough for everyone, and will not sort of disproportionately affect any ethnicity. I think that there's a lot of cultural reasons that also affect people's decision. And I think it's important for us to have a balanced view, and for people to not make assumptions based on what they've heard. I know there's a lot of like WhatsApp information that goes around, and a lot of people especially from the African community, I feel we are very quick to believe some of these things and take it as word. I think that we have to be very cautious, because a lot of these messages, these WhatsApp groups are full of a lot of misinformation. So we have to be able to take in the correct information and from there make an informed decision. So the main thing is for people to do their own research. Don't go off of maybe one of your sisters or a family friend. Don't go off of other people's own assumptions and opinions. Do your own research and make the decision for yourself. So yeah, that's my take.
Sir, if I could add on to that, I would support what Edie has said. I think in the DAME community, there's a lot of, we go by the rumor, we go by hearsay. We don't spend time to research into what we've heard. And I would say even for myself, I was guilty. With all the start of the vaccine, my initial response was, I'm not having it, I'm not the guinea pig. And that's because we think that the first thing is, vaccine, you're guinea pigs, you're in the lab. And with these vaccines being formed, it's an ethical, well-monitored process. And I think, part of the myth and what has affected the DAME is all the myth about the fact that it was rushed. It wasn't rushed. And it's something that what happened was that rather than follow the process, when you do A and then you go to B, you go to C, you go to D, what happened with this vaccine since April 2020 was that a lot of the processes that could be run parallel to one another was done. So rather than wait until you get to maybe stage D before you apply for funding was ready. Getting volunteers, because it was a pandemic, many people were keen unlike other illnesses, which, a lot of BAME communities are quoting, things like HIV. How come they've not developed vaccine for that? It's gone on for many years, and things like that. The thing is the process, because it's a pandemic and we can all see how much it was affecting everything in the world. Processes were put in place, support was there to run things in parallel. Many volunteers were ready to be used, as to take part in the trial process. And so these are the little things that affect the BME. So rather than go and read more about the vaccines, we just, any little news, we just run with it rather than, searching, studying more to know a bit more about the vaccine, the facts, the myths. And that's why sessions like this that we're doing, it's actually very good so that it enlightens us further and we get our facts right. Thank you, sir.
Thank you. Yeah, thank you very much. Before I move on, and I'm just going to ask a question relating to that as well in a minute, or maybe I'll ask it. I just want to launch a quick poll, and if I can ask people, the poll will come up. If you can just answer it. I'm not sure how it comes up actually, but I think it should come up somewhere. But the other question I wanted to ask, I don't know if you answered that already, is somebody asked the question that there's this thought that it has more side effects, or does the vaccine has more side effects on BME communities? Now, I think you answered it already, but you might just re-emphasize that. Does it have more side effects on the BME community?
The side effects are the same on everyone. The vaccine was, the phases of the trial was done on different ethnicity, and it didn't show that side effects are higher or lower in certain ethnicities. So it is the same side effect for everyone. I have taken this vaccine. Funny, I had next to nothing side effect, which was quite, surprising to my colleagues. So yeah, it just depends on who it is, but it has nothing to do with our ethnicity.
Right. Okay, great. Thank you very much. Okay, thank you for everyone that has answered the poll. If you haven't, can I still ask? It's still in progress if you can. I just want to have a rough idea how within the church or the congregation we have right now that are online, roughly what percentage are in the healthcare and what percentage have taken it and have not yet taken it. But even as we move on, we're getting quite a number of questions already, but some more questions, I beg your pardon. Well, one of the questions now, I know I've seen this as well being on some forums or one or two places, but something about the vaccine being experimented on human foetus. Is that true, or how true is it? And if it is, then what impact is that, and the ethical issues as well? Has it been experimented on human foetus? Does anybody know?
During the course, to be able to be a vaccinator and be able to answer questions like this, there is no evidence that is being used on fetus. And the other thing that has gone around is the fact that it contains fetal materials. That's not true. It doesn't have any animal products at all. When it was going to be tested on human beings, it was on people who gave, again, informed consent. They were told what the research was about and they consented, to being part of the research. So no, it's not being experimented on human fetus. And also, being in the medical field, that is unethical. And I'm almost sure it's a jailable offense. It's not something that the MHRA would have agreed to happen.
Okay, thank you. Still on that line, what impact does it have on fertility? So does it have any impact, or there's also been the sort of rumor that it can affect the person's fertility? Do we not have any information about that?
So there was sort of misinformation regarding this this myth, because it's a myth. There is a similar part of the protein sequence that is similar to some of the proteins found in the placenta. And this has been sort of people have taken this as, well, if there is similarities between the proteins found in the virus and the placenta, then it will have an effect on fertility. But it's simply not true. There's no evidence that supports this, and it's scientifically not possible either. So just categorically, this vaccine, and to be honest with you, any vaccine, no, there's no vaccine that can cause infertility. So yeah.
Okay, thank you very much for that. Okay, someone's asked about a couple of, let me try to put them together. First of all, in terms of, do we have a choice of which vaccine we want? And then also following on that, someone's asking that the first dose, if the first dose is Oxford vaccine, can they give you Pfizer as the second dose? And thirdly, which I think you already answered that, can I say no to the vaccine based on religion? So if you both want to, should I repeat those questions?
I think I got it, sir.
So the first question is that, do we have a choice of which vaccine we want? You know, there are different types. So do we have a choice? Can we specify the particular one we want? And then someone's asking that if the first dose is Oxford, can they give you Pfizer, or does it have to be Oxford as the second dose? And then a third question is, can you say no to the vaccine based on religion?
We don't, at the moment, we don't have a choice on which vaccine we are given. When you're invited to the vaccine center, it is what batch has been opened that is administered for that day. And that's because to make sure that the efficacy remains the same, there are guidelines as to how the vaccine is stored, when it is brought out, how it is stored, and the duration in the time in which it must be given, in which we're sure that it is still potent. So because of that, they will not bring out different batches for you to choose, because when you then bring out a batch, let's say a batch of AstraZeneca, and most people for the day want Pfizer, it means the AstraZeneca then goes to waste. So it is what is being given on that day. At the end of the day, it's still your choice. You could choose to come back another time, but then they're not going to say it's Pfizer today, it's AstraZeneca tomorrow, and both are effective. So, but you don't get a choice for now. Maybe as things develop, it's a new thing happening. As things develop, it might be available in which you can choose which one you want. But for now, the answer is no. With regards to the second dose, what's happening at the moment is when you have the first dose, there is a recall for the second dose within 3 to 4 weeks, depending on which vaccine you've been given, and the maximum interval is 12 weeks. So I'll just say on the average, we have between 3 and 12 weeks to give the second dose. If the center is properly run, the people that will be called for the second dose on a particular day would most likely be like for like the people that were there for the first dose. So for example, my own center, the Pfizer vaccine took about, I would say about 3 weeks before they ran out and then moved to AstraZeneca. So by the time the second dose of the Pfizer is being given, it will be the cohort of those patients that were there in that week. So as near as possible, it will be the same one that you've been given for the first dose that you will get for the second. But having said that, they've also thought of it that somebody might turn up and it's a different one. They're equally effective, no problems at all. If the person wants to come back, it's their choice. they will be fitted in and probably told when they're likely to go for the batch of the next one. But if not, the advice is that you can have Pfizer for the first vaccine and AstraZeneca for the second one. You're equally protected, and you don't have to have a third dose to be protected. So yes, it's possible to have two different ones, and it's still, you're clinically safe, you're clinically covered. You will build up the same antibody to the coronavirus infection. With regards to saying no to religion, I think what I would like is, if maybe more questions comes in, what about the religion? Because so far, for me personally, I've not seen anything in the Bible that says not to take the vaccine. So I think that question needs to be explored more. What about the religion would make us not want to take the vaccine?
Okay, thank you very much. Absolutely. Regarding the one of the things we need to remember is that it's God that every knowledge is from God. So it's God that has given the scientists, the technicians, the people that came up with the vaccine, the wisdom. I remember when we were praying, when the vaccine first started in the UK, one of the main prayer points that we used to pray was that God should give them wisdom on getting the vaccine right, finding the solution. And let's remember that it's God that has given them the wisdom. We believe God has given them wisdom. Now, in terms of saying no because of religion, I think maybe the concern, that I probably had was when I heard it was tested on human fetuses. But that seems to have been answered, and no, that did not happen. But from a biblical point of view, as Mefolo said, I cannot say anything in the Bible regarding that unless, God has given you a personal revelation, which, there are times people have a personal revelation. So some people, they say that, God tells them they shouldn't take drugs or something. I've heard that before. But if you've received a personal revelation that relates personally to you, then it will have to be, it's according to your faith. But nothing regarding what the Bible says, that we shouldn't take it, from my point of view. Just to add to that. Okay, Ibi, let me direct this at towards your sayings. You walk in the word, and it's a similar question. But basically, people have asked that, are there any benefits in taking vitamin C, zinc, and supplements in preventing infections? That's one question. And then somebody else asked a similar question, that are home remedies like inhalation of steam, taking vitamin C, etc., effective in preventing COVID? Now, I'm throwing that at you, since you work in the world, whether you've had patients that were taking those, or and then they developed it or not. But if not, yeah.
So just to speak generally about micronutrients such as zinc, vitamin C, and vitamin D, they work to actually support your immune system. They're quite important. So generally, we should be taking these to be able to make sure that our immune system is working to its full capacity. Now, when we talk with regards to this being a treatment, we go by evidence-based, treatment and procedures. And at present, there is no significant evidence to show, number one, that patients are, less likely to die as a result of taking, vitamin C and vitamin D supplements. And equally, there isn't enough evidence to suggest that just taking these supplements will outright prevent you from getting coronavirus. So I would say that it's important generally for your immune system. So take it to prevent you from getting any sort of infection any sort of, sort of general viruses that come around during winter, during, times where your immune system can get weaker. But there's no significant evidence to suggest that it can prevent it at all. In terms of hospital-wise, it's been interesting. There have been a couple of patients that have just said, "Oh, I don't want any of these, or any of these Western products. I just want, vitamin C and vitamin D." And obviously, because the hospital has to go by guidelines and protocols, we can suggest that, look, this is not what the evidence is showing. But patients, at the end of the day, they have the right to choose and refuse treatment. We can only advise them based on what we know has worked with other patients. So, on the ward. But from my point of view and from my experience, most patients are quite receptive to the standardized treatment that we have, that the UK is now using, which includes, antibiotics, steroids, and some other sort of trialed and proven drugs. So, yeah.
Okay, thank you very much. I've got a couple of more questions. I was hoping we'll finish at 8:30, but we'll extend it by about 15 more minutes, just to answer some of these other questions. Somebody is asking that since there's been a comparison, or a lot of comparisons between COVID-19 and the flu, with COVID being more infectious, just like how annual flu jabs are administered annually, would we be required to have annual COVID jabs? Anyone want to answer that? Do we know?
At the moment, we don't know. So this is something that has gone on, for the past, I think now about 10 months. And what we're sure of is the initial stage of it, in which it's been proven to be safe, effective, and we know what the side effects are, the immediate side effects. The 70,000 people that have put themselves forwards as to be used for the trial, what is happening is that they're still being monitored, and the level of their antibody, with time, things like that are still being monitored. Long-term side effects, they're being monitored. So time will tell as to whether we will need booster doses, same as the annual flu vaccine, or maybe 5-yearly boosters, like you have in some vaccinations, like the tetanus, hepatitis, that you need 3 doses for. So time will tell. We cannot rule out that fact that we might need, yearly COVID vaccines, or maybe a few years interval, but it's still in the early phase. We cannot rule that out. We don't know. Maybe it's a life immunity. Not sure yet.
Okay, thank you. Someone's asking, next question, as a medical professional, would you advise that people do a health check before getting the vaccine? And the reason why they're asking that is that a lot of people within our community may have unknown underlying health conditions that could trigger an adverse reaction. So what would you suggest? Do we need to do a health check before taking the vaccine, or we should just assume everything is okay? And I assume whoever is asking this probably may not be doing an annual health check, or maybe hasn't done one before, I assume.
It is good to have our health check done, as guided by our GPs. Mm-hmm. But that does not prevent us from being given or going for the COVID vaccine. You don't have to have a health check before going for the vaccine. If you're invited and you're convinced, you want to have it, then the advice is have it. Because even at the moment, the people that were initially given, in the first cohorts, they're all people, apart from the health professionals or the social workers, they're all people that have one underlying problem or the other, or due to their age, they're vulnerable. And the aim of this vaccine is so that whatever health condition you have, you don't become more unwell with the COVID infection. And so, yes, the advice would be to go ahead and have the vaccine. It's been given to people who are immunocompromised. It's been given to people, who are on chemotherapy. It's only that it is timed, to make sure that it's when their immune level is a bit higher up and they can deal with the vaccine. So it's been given to diabetics, people with hypertension. So your health shouldn't be anything that would hinder you. The only thing is, if at that moment, maybe the day you have you've been given the appointment, if you're feeling very unwell in yourself, you've got the fever, cough, you're poorly at that time, then it should be deferred until you're feeling better. But you don't need a health check before you have the COVID vaccine. It's safe to have.
Okay, thank you for that. Now, I'm not sure you'll have the answer to that, but someone's asking that the vaccines are pretty new. They're still pretty new, and we don't know what effects they will have on humans in future. Now, I assume that's referring to the alteration of the genes that we addressed earlier. But this person, is this a myth, or should we be concerned? Do we know what effects in future? Now, I believe it was addressed earlier, but I realized that some people they had some challenges logging on earlier because of the passcode. So if I can just ask someone to answer that for the sake of those that logged on late.
The mRNA being used for the vaccine, it doesn't have that ability to change your gene. So it will not go back and change what your DNA is. So that, just to bear that in mind. With regards to long-term side effects, it's early stages. We don't know, but so far it's been proven to be safe. It is sure that the mechanism is not for it to change whatever gene that you've had.
Thank you.
Yeah, just to support that. So mRNA is what it's meant to do is just meant to sort of tell our bodies to produce a protein that will help us to recognize and attack the virus when it does enter our system. It cannot enter the area where our DNA is actually inside, which is the nucleus. So there's no way it can enter where our DNA is. So that's just, it's a myth.
You're muted, sir.
Oh, okay. Oh, great. Thanks. I'm just seeing a comment, and I assume that relates to the earlier question. So I'll just quickly pick up on that. And I think the question was about refusing to take the vaccine because of religion. And somebody sent me a comment privately that it's probably because some people think that it's linked to 666 and the mark of the beast. From my point of view and my understanding of the Bible, basically, I guess what the person is thinking is that I know I've seen the misinformation about chips being within the vaccine, that there's some chip or there's some things in which they used to chip, which is the sign of the mark of the beast. I was looking at the composition of the various vaccines, although I don't understand drugs that much. but to my knowledge and understanding, I don't believe that there's, because I think it goes into the blood or something like that. And I don't believe that there is any evidence that there's any chip or any way of being chipped or monitoring us. But let me ask the professionals, is there any way or chance of something being put in the vaccine that would be an indication of the mark of the beast or being chipped?
I just, before Dr. Bim takes the question, I find this particular sort of question quite interesting because we're living in a world where we are already tracked. So we have technology that, right here, our mobile phone has tracked everything that we have done today. Our credit cards can track every transaction, literally locate where we are. So when you really think about it, even though this microchip is not true, it's a myth. I don't know what difference it would make, because we're living in a world where our every movement is tracked. But I do understand the concern with regards to the mark of the beast and whatnot. But just in the perspective to consider, yeah.
I'll come back to that.
Looking at how the vaccine is made, how it is for the Pfizer vaccine, it's frozen to I think about -70 degrees. Then you thaw it down to about -2, -8 degrees, and then you can leave it outside for 6 hours, up to about 25 degrees centigrade. And the mixing, you mix it with water, and then the amount we're given is so small. For Pfizer is 0.3 mils. For the AstraZeneca 0.5. I don't know, as in technically how a microchip will be put into that. And then, and some of the components of the vaccine, you've got things like fat, it's enclosed in a fat molecule. How a microchip would survive in that, and then it goes into your muscle. It's a bit of an effort, like Ibi said, when it's easier to monitor us using the phones and, all the things that we do from day to day. And then also it just comes more like an excuse not to take the vaccine. At the end of the day, there are various other vaccines which, microchips could be put into. We take our children quite happily to be vaccinated when they're born, and we do not say that there are microchips and that in it. When we're traveling, we go for our travel vaccine. So it's a bit, I don't know where that myth has come from. And then also my little knowledge of the Bible. If you're around by the time the mark of the beast is being administered, you've missed rapture. There is a problem. So if now what we're saying is that we're being given mark of the beast, well, that's a sad one, because it means we've missed rapture. So I think it comes down to BAME, not study the word, study facts, read, research, rather than, the rumors we hear, we just fly with it. And I've been guilty, honestly. The first time my colleague told me, will you take the vaccine? I told him it's the mark of the beast. I'm not taking it. But then, by the time you read, you research, you find out more, then you just think that really, no, not. It is not. And then another thing is just to add that I know that we say everybody has a right, you can refuse it. But what is also being said is that some places might insist on you having a vaccine before you can go to Ghana, you must have your yellow fever vaccine. So we might get to that stage where very subtly, you just find out that you have to. So it's better, forums like this, research, look into it. I know that I've read that in some healthcare settings now, the new contracts would involve, it will include things like, have you had the vaccine? Yeah. And if you swap it around also, honestly, if somebody comes now and tells me that all teachers in my child's school must have the vaccine because they don't want them to spread, or they don't want it to affect the teaching of those children, I will then readily say, yeah, it makes sense. So if in the health sector also, they're asking and saying you need to have the vaccine because we don't want that impact, on the services we're giving. And that's what we were told at my workplace, how many people are going to be unwell with COVID at the same time. So if they're giving something that will prevent you from being so unwell that you can't come to work for 4 weeks, Why can you not take it? So very gently, I think the world will gradually move towards that. If you don't have it, you can't come to certain countries, you can't do certain jobs. Medical profession, they will check your hepatitis, your load, the viral load. If you're not immune, you can't. If at that point where you get the job, if you've not had the jab, you will be given the jab before you can take the job. So I think we just need to research more. Like Pastor said, it's informed consent. So you can't be forced, but gradually the world is moving and we need to move.
Okay, well, thank you very much. But let me move on because of time. Time is fast spent. But okay, I'll take just 2 more questions and then we'll be done. Somebody asked the question, and I think we answered it actually. That's in terms of the potency. I'll leave that out. Right, I heard some GP surgeries are offering leftover vaccines to patients, so the vaccines don't go to waste. Is it true? If so, is it okay to book my vaccination this way rather than waiting to be called by the NHS?
Okay. Yeah. What I've experienced is that, like I explained earlier on, the vaccines are brought out in batches. So like the Pfizer, when you bring out one batch, is a batch of 195, and for each vial, I think you give about 2-3 doses for each one. So there are regulations to make sure that it is potent for the period for which it is brought out. And if it is not used up by that time, it has to be thrown away. So when it is brought out and it is ready, it's been composed and it's ready to be used, both for the Pfizer and the AstraZeneca vaccines, it must be used within 6 hours. Now, what surgeries have done is once they know the number of people that they're going to vaccinate for that day, if there's going to be a leftover from the calculations that they've made, they have people on the waiting list. So my surgery extended it to household members. So if there's any household member that is interested in the vaccine, they put the names down on the waiting list, meaning that within about an hour and a half, you can be called. So that's what people are calling leftover vaccines. It's not leftover in that it's spoiled or it's not equally potent or, effective. It just means that it's still viable, it's still effective, and they would rather use it than throw it away. And yes, you can have it rather than wait to be called. And once you're given, it's the same recording system. It goes into your GP record, so there will be no duplication. It will be noted that you've had it, the vaccine.
Well, thank you. Okay, I was smiling to myself because I just saw a question. Now, I understand this is quite informative, and rather than rushing it, people would rather have us answer all the questions. So if you permit me, I know I wanted us to finish by 1:45, but I think people are finding it quite informative. So we'll just try to take most of the questions as much as possible. But someone, right, talking about you spoke about the, should I call it yellow card program, which basically is about the health passports. I don't know if you'll have an idea about that or if anybody can answer that. But do you get a health passport recorded or something after you've taken the vaccine? So something that shows that you've taken it, and so if you want to travel or if you're asked anywhere, you can produce it. So is that something that is being given out now?
So at the moment, there is no actual passport like the yellow card. But what happens is in the UK now, even, if you do a coronavirus test, positive or negative, a report is sent electronically. It goes in your GP records, no matter the number of times that you do it. It's the same thing for the vaccination. So when you get there on the day, you're asked your name, your date of birth, you confirm the first line of your address and the postcode, and immediately your NHS record is brought out. And once the vaccine is given to you, they will document what vaccine you were given. And that's why most likely, if you had Pfizer for the first dose, you're likely to have Pfizer for the second dose because there is a record. So they would record what vaccine, the expiry date, the batch, when it was opened, and everything goes in your record. So you have it there. If then you ever need evidence that you've had the vaccine, your GP record can be printed out for you.
Okay, thank you. Just following up on that, a question regarding that, the data. Now, I'm not sure how this applies, but something about the fact that is this how they collect the MHRA data, or is this where MHRA is collating data? Now, I'm not sure. You probably might understand what that question is.
So the MHRA is the Medicine and Health Products Regulatory Agency. So for every medication, vaccine that is produced and licensed to be used in the UK, that's the body that monitors it. That's the body that has looked into the ethical, procedures and all. Now, I think if I understand this question properly, when certain medication is given, if you have adverse reaction to it, if it is something that is significant, then we report it to the MHRA and it goes in their system. It stays there. Now there are people that work there that then start to look at the pattern. So like we said, this vaccine is work in progress. If, for example, maybe 2-3 months down the line, we already know that things like sore arm, achy, so anybody who reports that, they're like, okay, we know. But if suddenly someone starts to say, I have double vision after the vaccine, MHRA, it's reported there because something that's significant, you will tell your GP. And once your GP knows about it, we record it into your records. So that is another form of yellow card. But that's for us medical people. So there's a yellow card for MHRA. That's not the travel card. That's where we report adverse reaction, allergic reaction to medication and products like that. And then if there's a pattern that is noticed, then the MHRA will raise an alert. And that's when we have, things going into the news, or an alert is raised to all medical professions saying, be cautious when you're using this. At times, there's some medication they stop if they notice quite a lot of reaction, significant ones to it. So that's also a safety measure for those that are worried about long-term side effects, that there is a body, everywhere. In the US, they've got their own body. I think there they even give you apps on your phone that once you think you have a reaction, you don't even have to go to your GP. You just feel it. But even for us in the UK, you can go online, Google MHRA, and then put it in, if you think you've had a significant adverse reaction.
Thank you very much. I believe that we do have one or two people probably from Nigeria as well. I'm not sure if he's on or if he's left. A friend of mine, Pastor Akinpelu, so I'm sure they will have a body in Nigeria as well that does that. Is that right? A similar body, probably. But okay, let's try. Let me try to round this up. Somebody's asked a question that if you have serious adverse effects from the vaccine, can you claim damages from the government or the manufacturer? So can we?
Okay. At the moment, the answer is no. And that's because with the corona infection, the pandemic, it's something that, over 100,000 people have died in the UK. The US, by yesterday, I think they had over 500,000 people had died. So it's a pandemic, and the initial thing was just get us a vaccine that is safe, effective, and we give to people, And if you're going to, it's like telling me, drive quickly to Tesco and just get me bread. If I don't eat that bread, I'm going to die. Drive as fast as you can. For me to then go that fast to save your life and speed limit, and you're somebody in the place of, so Boris Johnson tells me, drive fast to Tesco, I need bread or I'll die. I'll ask him, if I drive that fast and I break the speed limit, are you going to let the police give me a speeding ticket? Am I going to be fined? So that's about what happens also in medicine. With this medication and this vaccine being made, and that quickly, and for it to be rolled out, the pharmaceutical companies had to be given certain guarantee. And that includes the fact that, they are medical legally covered. And if I use the same example, it's like with the pandemic, we stopped patients coming into surgery and we will call them instead. And some GPs had to work remotely because of their health conditions or if they're isolating. Now, if you're working remotely from home, you're using your phone to block the number. So you're not using a GP surgery phone that the calls can be monitored. You're using your own phone. So if a patient ever accuses you of anything, it's your word against the patient's. Our defense union had to give us, and the government had to give us cover to say, if anything like that happens, we will cover you medico-legally. Now, what that means, I don't know. Maybe they will then take over paying the compensation and things like that. But for the pharmaceutical companies, they've been covered because it's work in process, progress. So if 3 years down the line, we discover any side effects that we're worried about, it's time that has shown it. They are covered in that context.
Amen. Amen. Thank you very much. Let me just take one or two more. You've already answered them, but I'm just aware of the fact that some people logged on late, and I just want to make sure. What I'm going to do also is I probably will post this on our YouTube page. So for those that may have missed the beginning, but just for the sake of those that logged on late, one of the questions that someone's just sent in regarding fertility as well, but just to, if I remember what you said, that there's no effect. Well, okay, I'm not sure who answered it earlier. Was it EB or Bifolu? If you just want to quickly repeat that about the impact on fertilities and on teenagers, people planning to get pregnant of the vaccine. I don't remember. Yeah, EB, go on.
So what seems to have happened is that some people have seen that there is a similarity with an amino acid sequence within the protein that is in some of the proteins that are in your placenta, and some proteins that are in the protein that is in the vaccine. And so people have made this is misinformed sort of decision or assumption that because of this it can adversely affect your infertility. So this is wrong. It's a myth. There's no evidence to show this, and it's not scientifically correct either. So just outrightly, the vaccine does not affect fertility.
Okay, thank you very much. And I think we'll round up here. I'll just address this last question as well, which you answered earlier, but I'll just answer it just for the sake of about the fact that if you've taken the vaccine, are you covered? Can you mix, or does it keep you safe? And basically what medical experts told us is that the vaccine, a person can still contract COVID even after the vaccine. It just makes the chances slimmer. So we still need to take the precautions that the government, that we still need to follow the government guidelines and all the safety measures. So the fact that we've taken the vaccine doesn't mean that we just go out and start mixing with people. We still need to follow the guidelines. And then I think there's another question that's coming, that is the vaccine still 2 doses or now 1? From what I've understood, I understand from what the government has been saying, what's been in the news, and also the conversation tonight, it's still 2. But in order to cover most of the population, they're giving 1 at the moment. And once they've done that, and then the second set or batch will be given. Is that right, Dr. Binfolu?
Yes, sir.
Am I correct in saying that? Okay, great. I think time is fast spent, and I believe that we've covered most of the questions. Now, for those that missed the beginning, I will be posting it, or we'll be putting it up on our YouTube page. So you can always go back to listen to it, and you can always send it to your friends as well. I just want to say thank you to Dr. Binfolu. Can you help me appreciate them online? If you can help me appreciate them both. I believe it's been very informative. It's answered quite a lot of questions and concerns that a lot of people had, and even with me as well. It's clarified some things for us. And if you, after the session, if anyone still has any questions or concerns, please send an email to me, to myself, or to admin@kingscourtchapel.org.uk, and then we'll make sure the question is answered by one of our professionals. Thank you once again. I just want to also acknowledge some pastors on the platform. Pastor Yomi joined us from Jubilee House, and Pastor Akin Akipelu, like I think I mentioned his name earlier, from Nigeria. I don't know if he's still online, but thank you very much for joining us. Thank you, everyone. God bless you. Thank you, Dr. Binfolu. Thank you, Dr. Ibi. Really appreciate your time. Thank you for sharing with us. God bless you. Good night, everyone.
Thank you, sir.